Hello, my name is Emma Payne and I'm a second year psychology student. Today, I would like to talk about applying behaviour modification techniques to overcoming a skin-picking habit behaviour. Scratching, picking, gouging and squeezing of the skin may most commonly characterise skin picking. It is, however, important for each individual to characterise their own skin-picking behaviour, as this may vary from person to person. It is also important for each individual to characterise this behaviour, as it may determine the severity of their particular habit. Consequences of skin picking may be scarring, tissue damage, and even in some cases skin infection, and it may be caused by nervousness, anxiety, stress, and even in some cases boredom. A baseline assessment is important in establishing the frequency of the behaviour, along with any antecedents and consequences. This can be done by asking the client to self-record or self-monitor their habit behaviour, and this may be done in the way of a form that the client fills out, and this may ask the client the date of the occurrence, the time, the place, people present, what happened before the habit behaviour occurred, what happened after, feelings before and after, as well as any additional comments. The items on the form may also assist in establishing any antecedents and consequences of the habit behaviour. A functional analysis of the baseline may also assist in distinguishing what triggers each occurrence of the target behaviour. Using a Likert scale that targets any feelings associated with the habit behaviour may also reveal any additional antecedents and consequences. For example, on a Likert scale, an item may ask, when I engage in a habit, after engaging in a habit behaviour, I feel a sense of relief. If the client answers often on a 5-point Likert scale, this may point us in the direction that a consequence of their particular engagement in a skin-picking habit is feeling a sense of relief. An effective intervention for a habit behaviour is known as habit reversal therapy. Habit reversal procedures involve introducing an incompatible behaviour to the skin-picking habit. So for example, if an individual picks at the skin on their fingers mostly, an example of an incompatible behaviour would be putting their hands in their pockets, clenching their fists tightly, or holding a pen tightly for about 1 to 3 minutes. And the competing response is supposed to be easy for the client and physically incompatible by the nervous habit. As skin picking is a behaviour that may not be conscious for some, a way of introducing awareness is, again using the example of someone who picks skin on their hands, is to put band-aids on the client's fingers. Every time they go to pick at their fingers, they'll feel the band-aids, and this will increase awareness of the frequency of the habit engagement. This is an awareness training component of habit reversal therapy. It is also important that the client keeps a tally of each occurrence of the behaviour during intervention. This allows them to track their progress and the frequency of each engagement of the behaviour. Although the incompatible behaviour may lead to a reduction in the occurrence of skin picking, it is, however, necessary to target any negative feelings associated with what had initially caused the habit. In other words, we need to fill the void that has been created by the loss of the habit behaviour as a mechanism in reducing stress, anxiety, and boredom. What I mean here is that if we have a client who has a skin-picking habit that is associated with anxiety and stress, they can engage in an exercise such as mindful and deep breathing that may assist them in dealing with any negative feelings associated with the behaviour. So I'll just demonstrate an example of a mindful or deep breathing exercise. So if you sit back in your chair and you sit upright, put both your feet on the ground, put your hands in your lap or wherever feels natural or comfortable to you. And then if we just count to 5 in our head on inhalation, and again on exhalation. The aim here is to slow down the breathing and to allow the client to focus on what is happening in the present moment with their body, which in turn may reduce feelings of anxiety. Once learned, these techniques can be applied to day-to-day life. They can be modelled to the participant and used as a weekly assignment so that they can practice such an exercise in various settings. using prompts may also benefit the client. Another component of behaviour modification that can be applied to a skin picking habit is introducing weekly targets of the amount of occurrences of skin picking that the client is allowed to engage in. If the highest number of occurrences in baseline is 10 times, then in the first week of intervention, we might ask the client to only try and engage in the skin picking habit maybe 8 times. In the following week, we might try and ask them to only do it 6 times, until we reach a number of 0 occurrences. This is known as differential reinforcement of low rates of responding. If the client is unable to reach these goals, then we can just raise the number of allowances or just decrease the allowances at a slower rate. It is important to use praise if any attempts at progression are made or if any progression is actually made. Asking friends, families and colleagues to also use praise is an important way of showing the client that they have social support available to them. Social support can also be used as a part of awareness training. So asking friends, family and colleagues to point out to the client when they're engaging in the skin picking behaviour may be beneficial. I have recently done my own project on someone with a skin picking habit behaviour, and we decreased the number of occurrences from 10 in the baseline week to 4 in the final week of intervention. So this shows that these techniques can really make a difference to your skin picking habit behaviour. I hope these techniques were of use to you and that they can assist you in overcoming a skin picking habit behaviour. Thank you.